Whenever we are working with our patients with foot pain, it is mandatory that we also look above the foot. So one of the concepts we wanted to talk about was something called proximal stability, or making sure that our rib cage is stacked over our pelvis. Oftentimes we will see patients that lose that stack. Either the rib cage will flare, the pelvis will dump forward, or they can even tip back and go the other way.
Just like Dr. Conley said, it is very important that we're looking above the foot, because if you stand up right now, you'll be able to feel this. If you stand with your feet nice and relaxed, about hip width apart, and then start to tilt your pelvis forward. And again, do this with your feet relaxed, which also may be in itself difficult for some of you. But when you start to bring that pelvis forward, like we're pouring water out of the front of a bowl, your feet will start to dive inwards. And then if we do the opposite, if we start to bring our pelvis back, like we're gonna pour that water out of the back of the bowl, you'll start to feel the arches lift up. So the positioning of the pelvis has everything to do with the positioning of the lower leg and foot as well, which is why we want to make sure that we're not just looking at the foot. So this video series is going to be a few of our favorite exercises to learn how to find your pelvic position, right? Because as Dr. Conley said, that one isn't better than the other, but we need to be able to find where our pelvis is and find a more stacked position. And then also how to start to strengthen our core around that.
So the first thing that we're going to want to do is just breathe. We're going to do a slow inhale through the nose, and then an exhale through the mouth. And if you notice, I'm just letting my spine move with me. So everything is moving gently as I'm breathing. What we don't want to have happen here is an abdominal or tension in your belly. So we're always cueing loosey-goosey. Let your belly go loose, jiggly. So again, the inhale is very relaxed. And as you can tell, when I inhale, my pelvis is starting to move. When I inhale, my low back is almost arching. When I exhale, you can see how my pelvis is tilting backwards. For those who have a difficult time doing this, you can take a foam pad and place your feet on top of it. That's going to shift me backwards a little bit. And then we can do the same breathing. When we find that we're more in this position, so my rib cage is flared and I'm more tilted forward, one of the tissues we want to be able to find is the proximal hamstring. Oftentimes when you're training people to find their hamstrings, they'll feel it in the muscle belly and not in the origin of the hamstring. So for this drill, you're going to exhale. You can see how my rib cage is going to depress. And when I get to the end, I'm just going to gently drag my heels towards my butt. And I'm going to feel a little bit of activation right at that proximal hamstring. Again, I am not contracting my abdomen to the point where I'm almost not being able to breathe. So it's very gentle. Exhale. And a slight heel drag. And we'll hold this for about 10 seconds and then inhale again. So once we're able to get better mobility and stacking of the rib cage over the pelvis, then we want to work on just finding that hamstring and being able to hold it. So I'm going to start on my right leg. I'm going to walk my leg out a little bit and I'm going to lift up the front of my foot. I'm going to inhale, exhale. I'll get all the air out. You can see how my rib cage is coming down, stacking over my pelvis. Then I'm going to slightly rock backwards and I'm going to drag my right heel towards my butt. Right away, you can feel the activation at that proximal hamstring. We can hold here for 45 seconds and repeat that 5 times. We can also make things a little harder if I wanted to walk my leg out. Same concept. Inhale, exhale, a little bit of that tilt, and then I'm dragging my heel towards my butt. You can really feel that posterior chain, especially in that hamstring.
Now that we've learned how to find our pelvic position in a supine or laying on your back position, we're gonna move to a seated position. Here, I wanna bring the focus to the pelvic floor. So what I'm going to do is I'm going to do the same thing where I start to rock my pelvis forward and backward. Again, imagining the water pouring out of the front of a bowl and then out of the back of the bowl. If you find one to be more difficult than the other for you, then that's the area that we want to focus on. And then once we start to get a little bit more familiar with this, we can kind of rest in the middle. This is where we want to find our stack. When we say stack, we're looking for the rib cage to be stacked over the pelvis. This is where our core is in a very stable position. If you imagine a Coke can, our diaphragm would be the top of the Coke can, and our pelvic floor, which is all of the muscles underneath, are going to be the bottom of the Coke can. This is where we want to start to create pressure. So I'm going to stay in my stacked position. I'm going to inhale. And as I inhale, I want to feel my muscles drop into the chair. Think about if you were trying to inhale and fill your underwear with air. Inhale through the nose, and then exhale and lift off of the chair.
Another option to work on this stacking is to go into an all fours position. So I'm going to place my hands on the floor. I'm going to keep a slight bend to my elbows. I'm going to round my lower back and look down. In this position, I'm trying to stay flexed and rounded throughout my entire spine. I can stay here and inhale and then long exhale. On that exhale, you want to feel that rib cage start to depress. You can stay in that position for 5 or so breaths. And to challenge this, what you can do is stay rounded. I'm going to lean forward. I'm going to imagine that I have fire under my belly, so I'm not going to sag here. So I'm going to stay tucked. I'm going to lean forward. My elbows are slightly bent, and then I'm going to lift up my left arm. And I can do my 5 breaths from here. Inhale and long exhale. When I lift my left arm, you should feel an activation in your abdominal wall on the right side. And then you would do the same thing, lifting the right side, and you would feel more tension on the left abdominal wall.
Okay, now that we have worked on pelvic positioning, laying down and seated, and then in a quadruped position, it's time to take it to standing. So the first progression here is again going to be to find our pelvic rock. Look for a more stacked position where our pelvis is directly underneath our rib cage and our rib cage is not flaring forward. So now that I'm in this nice stack, I'm going to maintain this position. One cue that I like to use is if you put your thumb on your rib cage and your fingers on the front of your pelvis, right in this bony prominence, then you can make sure that when you go to shift into balance, we don't start arching our back. So again, place your thumb on the rib cage, fingers on the front of the pelvis, and then we're going to shift into single leg balance. We can start with just balance, building up to 30 seconds and building up to 1 minute per side. Then we can start to add load. When we start to add weight, it adds requirement. We have to start contracting our core. So we can take a weight or a cast iron skillet or a bucket of water if you're doing this at home. And now again, I'm going to get my stack, have my fingers on my rib cage and my pelvis, and then move into balance. Starting with just holding here. And then another progression would be to start to pass the weight from side to side, because this is also going to require that I use my foot, my hip, my leg, and my core to work together to maintain this position. So when we talk about adding load to work on keeping the ribcage stacked over the pelvis, building proximal stability and building strength, we want to work with some kettlebells. And when we talk about adding load, we're not talking about 5-pound kettlebells. So you want to pick up some weight. So first thing we're going to do is work on our balance. I'm going to create kind of stiff arms here, and I'm just going to lift and hold. You can hold here for 20 seconds. You'll really start to feel the outside of the left hip. Then we want to do the other side. Press the foot through the floor. Get stiff, get strong. Then what you can start to do is walk. Pick up your weights and then just walk with heavier loads. These are called farmer's carries. They will also work on not only strength
of the abdominal area. But keep in mind, when the foot is on the ground, the glute is in charge. It will work on frontal plane control as well. We definitely want to stress to you that if you are suffering from foot pain, you not only have to work on your foot strength and your foot mobility, but you have to see who's driving the car. We want to make sure that there's good proximal stability, that you have good control, good tension from the top down.